So this was it was a platform trial. So what it means is it was several different cohorts, and the colorectal cancer cohort actually filled first. So those are the results that we were presenting at the GI ASCO. We enrolled 30 patients on this trial, and it was a very heavily pretreated population. It was 1 to 10 prior chemotherapy lines, and the median was about 4 lines of prior chemotherapy. So very heavily pretreated patient population. So there were 13 patients, 7 patients who haven't had prior bevacizumab, so 23 had prior bevacizumab. And this arm of the trial did allow for prior bevacizumab for the patients. So looking at the efficacy of the trial, out of the 7 patients that had not had prior bevacizumab, 2 had a PR. And those 2 patients, the PR was 85 on 122 days, and one of those PR patients is still ongoing. But what's also very interesting is that 15 of those 30 patients had stable disease with a median duration of 126 days. So that's more than 3 months, more than 4 months of median duration of stable disease, which is quite interesting in this population, so heavily pretreated. So overall, 17 out of 30 patients had a benefit from the treatment. One of the other things that I think, just looking at the toxicity and the quality of life of patients on this trial, it was pretty well tolerated. The main side effects we saw, was nausea and peripheral edema was, mainly what we saw. But we have patients on for trial more than 1 year and tolerating the treatment very well. And I, compared to TKIs and Rego, this combination, I think, from a patient perspective, is less toxic. It was a very interesting study, and patients really benefited from the treatment. We see 2 PRs. We saw 17 out of 30 patients having benefit from the treatment. And so I think that was encouraging results. It is an early trial, only 30 patients, but it's nice to be able to offer patients an option. The problem with this patient population with MSS colorectal cancer patients are that, we are overall with colorectal cancer seeing a decrease in incidence, but an increase in incidence in patients who are younger than 50. So, and that's my personal, what I see in my clinic is that we see all these patients who are 20, 30, 40 years old. And, after 2 lines of therapy, we really don't have good options for these patients. So finding a good treatment, something that's durable is of essence in this patient population, a very high unmet need.